So last time we have covered this enteric nervous system of the stomach, abdomen. Now we cover the kidney, last organ of the abdomen. All we have covered pancreas, spleen, stomach, liver, intestine, all. So here we start the kidney, basically renal system, the urinary system. So first, its length is around 11 to 12 centimeters. Breadth is around 5 to 6 centimeter, and width is around 2 to 3 centimeter. Weight approx 150 grams. Okay? So these are some points about it. Now shape shape we know it as bean shaped. It is bean shape. So first how it look like. So we know, let's say this is the kidney. Remember the upper pole is slightly bigger than lower, and this is the hilum portion. Right? Upper pole is slightly bigger. It has two parts, one upper pole and big lower pole. We divided surfaces and borders. It has surfaces uh, it has two surfaces, basically anterior and posterior. We can say anterior and posterior. Anterior and posterior. We can also say slightly anterior, superior, and posterior inferior because it is slightly tilted posterior. Two borders, medial and lateral. Hilum and one hilum. That, and there are segments. It has five segments, basically five segments. Four are in anterior. Anterior, these are anterior. How and five segments form? One anterior and posterior. In anterior, we have upper pole, superior segment, inferior segment, and lower pole. And the one is posterior segment. So these are the five segments form in the kidney. One 2, 3, 4. Anterior segment is divided into 4, but posterior not. So how it forms? So let's above the kidney we know there is a gland called suprarenal gland. This is the suprarenal gland, and here is division. This is the upper pole. This is the superior surface, inferior surface, and the lower pole. That this is the lower pole. This is the inferior surface. This is the superior surface, and this is the upper pole. So these are the segments. This is the anterior surface. Anterior surface. In posterior, it has only one surface. Posteriorly, it is divided like this. This posterior side, is the upper pole, and this hole is the posterior surface, posterior segment. Posterior segment. This is upper pole. This pole is contained in both sides. This is the lower pole. Then, so first, how kidney located orientation is important. That this is anterior side. This is anterior side. This is posterior side. Then anterior and posterior, like this. Hmm? Anterior and posterior. Now come to the orientation of kidney. How it is oriented. So for kidney location, it is we use a parallelogram like figure, which is called Morris parallelogram. Then first note this. Remember this thus. Let's say this is the T11 vertebra, and T11 vertebra has spine, and this is the lumbar vertebra. Here we draw lumbar vertebra. So here, so this the parallelogram form in between this, and kidney are located like this. One is upper pole and the lower pole. We know the right kidney is slightly lower than the left kidney because of liver, so we draw left kidney slightly higher. But so there are some measurements here. This is the central line. The gap between the poles and here. This is around 2.5 centimeter. From the hilum, it is around 5 centimeter from one side. Hilum. Then lower pole, it is around 7 centimeter. And then whole kidney. This is 9 centimeter. So there is a parallelogram form here like this. This is the parallelogram like structure form. Then this called Morey's parallelogram. Remember, the anatomical position of kidney is upper pole is above and slightly tilted backward. Anatomical position. Bigger pole is upward. Big pole is upward, and kidney is slightly is tilted as anterior surface slightly superiorly facing. Anterior surface is facing slightly upward. Slightly upward. That like this. Let's say this is the whole kidney. How it is oriented in anteroposterior. So let's say this is the kidney. This is like this. This anterior side. This is the posterior side. This is anterior and this is posterior. That this is the kidney. Anterior surface and posterior surface, like this. Done. So this is the Morley's parallelogram orientation. How it is oriented. Now come to the blood supply. Blood supply and all. So here we know a hilum present, blood supply, blood supply of kidney. Then so blood supply, we know the anterior aorta, it gives the branches called renal vein, renal artery. So it started from the anterior abdominal aorta, abdominal aorta. We draw a chart in which blood supply, veins and arterial supply both are covered. Abdominal aorta से, which is renal artery. Which level? At L2 level. Then it inside, first it divided into two. Remember, according to segment, there are five segments in kidney. So there are five segmental arteries. First, anterior and posterior, and then segmental. Five segmental branches. Segmental arteries like this: anterior and posterior. The anterior divided into four: upper, superior, inferior, lower, pole basically. Then these segmental arteries go into the low. We take only one artery, one segmental artery. Let's say this is the superior. So each artery, then it go into the lobule-like section, lobule artery, which is called lobular artery. Again branch, division basically. Lobular, lower artery. Then again interlobar artery. Then we draw this artery, how it look like. Arcuate, arteries, then intralobular. Then after this intralobular, we go into the afferent arteriole. Afferent arteriole, remember, it is a branch in which go into the glomerulus capsule. Afferent arteriole, arteriole. Arteriole. Then after efferent arteriole, one is efferent arteriole. We know efferent arteriole. Then peritubular and vasa recta. Peritubular and vasa recta. Then is, we know, similar pattern again continue like this. These are interlobular arteries. Then come to the vein. This similar pattern go in reverse direction. If interlobular vein, arcuate vein, interlobular vein, then lobar vein, lobar vein. Similar pattern like this artery. Then segmental, then renal vein. So this is the whole blood supply of the kidney. How it supply the organs basically. Whole blood supply of the kidney. Then first how it is oriented. So for orientation we take a bigger section. That here. First we draw the kidney. Slightly bigger. This is the island. Remember kidney is divided into many medulla and cortex pyramidal sections. So these are the pyramids basically. These are pyramids. Then so first we know the renal artery come, then it divide into segmental arteries 1 and 2. So first we take anterior section. This is the first segmental artery. Then it divide into lower arteries. Many. Then lower arteries go into the interlobular. Interlobular is like this here. Then interlobular continue into arcuate. These are the arcuate basically. And then intralobular. These are intralobular. So this is the pattern. After this, the venous pattern also similar. Then after glomerulus, efferent, atrial, peritubular, vascular. After this intralobular veins, then arcuate veins, then lobular veins, and then lobular veins after interlobular, then lobular, and then segmental vein, and then renal vein. So first we name it. This is the renal vein, renal artery. Sorry. Renal artery. After this, segmental. One segmental artery going to the posterior. Segmental arteries many more. One above, go down, but we clear diagram. Segmental artery. After this is the lower artery. Then this is the interlobar. These are arcuate. These are intralobular. And this is the similar pattern of vein. This is the renal vein. Then, so this is the blood supply of the kidney. How it is oriented like this. Then, now come to the structure of the hilum. In hilum, there are many important orientation of the structures. Orientation hilum is like this, anterior to posterior. Let's say this is the hilum portion. In anterior most, There is a vein called renal vein, obviously. Then after this, there is segmental arteries. Segmental artery divide before entering into kidneys, anterior and posterior segment. Done. And one important slightly one small artery also present, maybe sometimes or sometimes not. And after this, there is a in most posteriorly it is called renal pelvis, basically from which the ureter extends. So this is renal vein, renal artery. This is called subsidiary artery. It is a branch of renal artery, accessory renal artery, branch, subsidiary, subsidiary artery, branch of renal artery just, and renal pelvis basically, renal pelvis, pelvis. This is the anterior side. This is the posterior side. Arrangement of structure is like this. Anteriorly van. So we can write VAP. VAP. Van, vein, artery, and pelvis. Then so pattern of arrangement in hilum. And we know some lymphatic nodes also present here. Lymphatic nodes may be present. Lymphatic nodes is draw. These are the lymphatic nodes. We draw. Pre-aortic lymph nodes. These are lymph nodes. Lymph nodes. Then and some nerves also present in which, let's say, these are the splenic nerve, renal splenic nerves also present here. This is splenic nerve, renal splenic nerve, splenic nerve. So basically, these are the structures in the hilum region. Lymphatics, first write the supply. Lymphatic is pre-aortic lymph node. We know there are the pre-vertebral, pre-central arteries of the aorta. Pre-vertebral कह सकते हैं, celiac trunk, superior mesenteric, and inferior mesenteric. So there are similar lymph nodes also present. Celiac lymph node, superior mesenteric lymph node, and inferior mesenteric lymph node just below the artery. Three similar nodes are present. These are called pre-aortic lymph node because at the center there are three nodes. Pre-aortic, similar like arteries. Celiac, superior mesenteric, and inferior mesenteric. Similar like similar pattern. Done. Blood supply, venous supply we have done. Splanchnic nerve supply is the sympathetic supply. This sympathetic supply. Okay. Supply. and we know nerve supply. And parasympathetic is from vagus. This is from vagus. Then is the nerve supply and lymphatic drainage. After this, we cover the fascia of the kidney. Fascia. Of kidney. So fascia of kidney is like this. Let's say this is the kidney. We draw the superior view. Superior view. This is the kidney. So we know that above the kidney there is a diaphragm, and fascia of the diaphragm is called diaphragmatic fascia. So diaphragmatic fascia extend below and cover the kidney. This is the first. This is the superior view. So diaphragmatic fascia, one is anterior layer which covers the anterior surface of the kidney, and the one is the posterior surface. So here is the, let's say this is the anterior layer, superior layer. This is the superior, and one is the posterior layer. Done. And here near the kidney there are many lots of fat present between kidneys, and this is the fascia. This fascia of kidney is called fascia of Girota. Zerota. Then let's say this is the kidney. Above kidney there is a renal capsule which is the covering of the kidney. So first it is renal capsule which is kidney covering. Then this is the kidney fascia which is called fascia of Zerota. Fascia of Zerota. Then this fascia of Zerota has one anterior layer. This is the anterior side. This anterior and this posterior. So it has anterior layer and posterior layer and different names. Anterior layer called fascia of Tolt. Fascia of Tolt. And posterior layer is called rear layer, called fascia of Zucker candle. Candle. That these are the names. And the fat present here, the inside the fascia and outside the fascia also present fat. There is a lot of fat present near the kidney. So these fats also have different names. This fat is called pre-renal, prenephric fat, fat. So this is para nephric fat. Lots of fat present here, and there is a one important thing is a connective sheath also present here, and all vessels and nerve piercing it and then enter into kidney. It is called connective sheath. Connective sheath. All nerves and vessels pierce it and then go into kidney. Then so this is point. Now first draw the section. This is the superior section. We draw the coronal section. Next. Next is the coronal section. So coronal section, let's say we know this is the diaphragm above and here is the kidney. Then so from the diaphragm, this is called diaphragmatic fascia. The fascia it extend and cover the one anterior layer anteriorly and then posteriorly and descend down. So this is the fascia. This is the diaphragm, renal fascia, and then we know the fat present inside and outside. Whole there is a fat present. Okay? So this is the fat coronal section, basically. Coronal section because we cut only coronally, anterior and posterior layer. Basically, sagittal भी बोल देते हैं sagittal because we can see both layer sagittal. Sagittal. So it's not coronal, sagittal. Sagittal section. Sagittal section. Then now draw the relations of the kidney. So for posterior relations, we draw a diagram and write relations of kidney. For posterior relations, we draw a diagram. Again, let's say this is the diaphragm crust and this is the diaphragm. Done. So here we know vessels, subcostal vessels emerging. These are the posterior relations and subcostal nerve. and here is the muscle present. This is a muscle called psoas major. Then more laterally, another muscle called quadratus lumborum, and another is transverse abdominis. These are three muscles. Then we know here a nerve called ilio hypogastric and ilioinguinal nerve. This is the ilio-hypogastric and ilioinguinal nerve. Then these are the nerves which are where post relations. These are the things which are post relations. Kidney is like this. If we draw the kidney, kidney is like this. This is the kidney, and all these things are the posterior relations. So here we can write posterior relations में posteriors. Then posterior में we can write this is psoas major, quadratus lumborum, transverse abdominis, yes, and subcostal vessels. These are subcostal vessels and nerves. Vessels and nerves. These are ilioinguinal and iliohypogastric. Guinal and iliohypogastric. These are different nerves. Hmm. Draw a line for this. These are different. Right? Iliohypogastric, and we know of a nerve which is piercing the psoas major, which is called genitofemoral nerve. So genitofemoral nerve also present can also be the relations in posterior relation. This is the genitofemoral nerve. So femoral nerve. So all these things are the posterior relations. Subcostal vessels nerve, iliohypogastric, ilioinguinal, psoas major, quadratus lumborum, transverse abdominis, and genitofemoral nerve. All these are the posterior relations of the kidney. This is the kidney. Then this is the diaphragm hole. Diaphragm also. And one, so we write here first. Next, these are the posterior relations. 1, 2, 3, 4, 5, and 6. Next, we draw kidneys anterior relations, anterior impressions. So basically, anterior relations are different for two kidneys, left and right. So we draw both kidneys. Anterior relations, they are different for different kidneys. So first we draw the right kidney. So right kidneys also look like this. Then here above we know the impression for which gland? Suprarenal gland basically. Impression for suprarenal gland. Then this is the impression for suprarenal. Then we have impression for liver, hepatic impression. Liver impression basically this is the liver impression. After this, there is an impression for hepatic flexure of colon. This is the impression for hepatic flexure. One is hepatic impression and one is hepatic flexure. These are different things. And the last is impression for jejunum and ileum coils. So here, this is suprarenal gland, renal gland. This is hepatic impression. This is hepatic flexure. And this is jejunum coils. Jejunum coil and ileum coils all. Then next we go to the left kidney. Just to displace it. Done. So these are the anterior relations. Next, here of right kidney. We draw the left kidney. So left kidney has impression, basically impression for spleen, stomach, pancreas. All these are impression for left kidney. First, this is the kidney. Then, so we start from the above, like similar color pattern we use. This is the suprarenal impression. Then we have another impression for spleen, basically splenic impression, like this. This is the splenic impression. And here is the gastric impression. For gastric impression, we use different color. This is the gastric impression. This is the gastric impression. Stomach present, we know. Then we have impression of the pancreas, for pancreas impression. This is the pancreas impression. Then after we have splenic flexure. This is the splenic Splenic impression for spleen, this is the splenic flexure. These both are different things. And after this, we have impression for jejunum coils. Similar. Some place we use similar color for similar impression. Then we write this is the suprarenal gland. This is splenic impression. This is gastric impression. This is pancreatic impression. This is splenic flexure impression. And this is last jejunum coils. Similar. Because coils present on both sides. Jejunum coils impression. Done. So these are the relations of anterior and posterior relations of kidney. These are the important things. And anterior relations, and these are the posterior relations. One important thing we want to draw here. Remember, there is a gland also present here. This fascia cover the gland also here. The gland, this is the suprarenal gland, which is also covered by that this fascia. Suprarenal gland. This suprarenal gland also have different blood vessel supply. It has three blood vessel supply. Suprarenal gland, one superior artery for suprarenal gland, one which is originate from the diaphragmatic artery. Middle middle arteries for suprarenal gland originate from the abdominal aorta, and inferior is from the renal vein. So it has three arteries. We write here superior artery, middle artery, and inferior artery. Hmm. It is a branch of diaphragmatic artery This is branch of this is abdominal aorta branch. We write abdominal aorta, and this is branch of venal artery. Right? So this is the blood supply of the suprarenal gland, like this. This is important point for suprarenal gland. Hmm. Next we cover the some clinical. Yeah. Also, first is polycystic kidney fibrose kidney, polycystic kidney, in which it is an embryological defect in which ureter and metanephroblastoma is not fused. Remember, defect embryological defect in which ureteric bud ureteric bud is a part which form the basically which part secretory part basically renal pelvis conducting tubule right secret collecting part collecting duct and metanephroblastoma metanephric blastema which form the glomerulus PCT DCT glomerulus not fused. These two parts are not fused. So what happened if these two parts are not fused? So glomerulus continuously form the urine, but it cannot go into the collecting duct. Here, what happened? Glomerulus form urine, but not go in collecting duct. So it accumulate and form the cyst. So it accumulate accumulate and form cyst. Basically bubble like swellings also form. Cyst form. Accumulate and form cyst. Swellings, these are swellings. Bubble like swelling. Done. Next is horseshoe shaped kidney. Hmm. horseshoe-shaped kidney. It is also a neurological defect in which two kidneys are fused from the inferior pole. Basically, two kidneys are fused from the inferior pole like this. Their inferior poles are fused. These poles. Two kidneys have fused inferior pole. So what happened? Kidney form in the lower region, but it ascends upward. But it is horseshoe shaped, so it is blocked by artery which is called inferior mesenteric artery. So we write here it form in lower region, but ascend upward and ascend. It form in lower region and ascend upward. Upward. But due to this horseshoe shape, it is blocked by but horseshoe shaped kidney. Normally तो पहुंच जाएगा अपनी जगह पे basically. Normally it can reach to the normal place. Horseshoe shaped is blocked by inferior mesenteric artery because it is the most near. Remember, these are the three arteries we know. In most lower, inferior mesenteric, then superior mesenteric, then celiac trunk. So it ascends upward. So first it is interact with the inferior mesenteric artery, so it is blocked by this inferior mesenteric artery. We write here okay, inferior mesenteric artery. This artery is like this. It blocked it. This is IMA. That so these are the two clinical points of the kidney. So this is the portion of the kidney. Kidney supply, lymphatic drainage, nerve supply, relations, orientation, blood vessels, sagittal section, clinical, posterior anterior relations, all these. Now we come to the ureter. These are notes. And these are the notes of the previous section, previous lecture. So our next topic is ureter. Ureter is our next topic. So ureter is it extend from the kidney, extend from hilum, renal pelvis basically, extend from pelvis, renal pelvis to bladder, urinary bladder basically. Length, its length is 25 to 30 centimeter. Okay? So it's look like this. Let's say this is the kidney and here is the bladder. Here is the bladder. So it extend like this. One important thing is we know there is a brim present which is called pelvic brim because it extend into the pelvic region and because bladder is present in the pelvic region so it extend on the pelvic region basically pelvic bones के जो ring which is it is called pelvic brim pelvic bone the ring formed by the all pelvic bones basically posteriorly the sacrum iliac bone all form a complete ring which is called pelvic brim. This is the pelvic brim. This extend from the inside here and then go to the bladder laterally at lateral angle. So there are constrictions form in this. Constriction form in the blood ureter. Constrictions of bladder. Then so there are five constrictions. First is this from it starts at renal pelvis, which is called pel ureteropelvic constriction. Ureteropelvic constriction. First, second is like this. Second, at the point of this, at pelvic brim, pelvic brim, which is second. After this, in pelvic region, we know an important duct which is called vasa recta. It also passes over the ureter, so it forms the constriction. So this is the duct. This form the constriction. Here is constriction form. This is vasa recta. At vasa recta, we write vasa recta cross ureter. But this is in males. In female, the round ligament. in males, but in females it is round ligament. Females, round ligament. Then after this, then at the point where it enters the bladder, this is the fourth point. This at point where it enters in bladder. Done. And the last, this where it opens in the bladder at opening of ureter. Done. So there are five constrictions in the ureter. Done. Now come to the blood supply. So blood supply is much easy. This is the ureter. At the pelvis region level, we know a artery called renal artery. There's the renal artery, so it gives a branch to supply the ureter. This is the renal artery. Then there is an artery called gonadal artery. It also gives the branch superior and inferior, which supply the ureter, gonadal artery. Then where it crosses the pelvic bridge. There is an important point here is this point at pelvic bridge. It is also the point where where common carotid artery, common iliac artery divided into external iliac and internal iliac. So we write here it is also a point where common iliac artery divide into external and internal iliac artery. This is the point where pelvic represents this. So here it is the point common iliac artery. Common iliac artery also have direct branches. common iliac artery. Then external carotid. This is the external carotid and this is the internal carotid. These also give the branches. External carotid and internal carotid. Many arteries give branches. Internal carotid artery. This is the we write. This is common iliac artery. External iliac. This is internal iliac. Internal iliac all internal iliac many artery like superior vesicular. These give branch. Ocular, middle rectal, so these give branches, direct branches. Branches are these are branches of internal iliac artery. This also give the branches to the ureter. This is the blood supply of the ureter. So arteries, how many arteries involved? One, two, three, four, and five, and their branches. So this is the blood supply. Then venous supply is also similar. Renal vein, gonadal vein, common iliac, external iliac. Venous supply is also similar. This is the arterial supply. And here is venous supply. Venous drainage. Similar. Renal vein, gonadal vein, common iliac, external and internal, internal iliac vein. This is similar venous drainage. Done. Now come to the relations. Relations are similar posteriorly and anteriorly. Posteriorly, we know the iliacus muscles and nerves also present here, and vas recta anteriorly. Some relations we write only. First, we take posterior. Posterior, we can write because it is also present near the iliacus region, so it present iliacus in front of the iliacus muscle. So we write iliacus is muscle, then posterior right. All psoas major, quadratus lumborum also include because above region. Psoas major, muscle, quadratus, lumborum, because we know we have read in the previous section iliacus region, nerves also include here, muscles and nerves. Nerves, which nerves? Basically, we can write lateral cutaneous, nerve of thigh, Then that's all. These are some posterior relations. Then come to the anterior. Anterior is some we know basically the jejunum, ilium, all coils are jejunum, ilium coils we know. And in front peritoneum present. Peritoneum is the most common. It is because it is a retroperitoneal. So peritoneum is in front and peritoneal and their organs, basically intestine, peritoneal and intestine. But in left side, let's say this is the left ureter. This left ureter. So here is sigmoid mesocolon present. It is likely it is inverted V like. So here sigmoid mesocolon present. This is sigmoid mesocolon in front for sigmoid colon, sigmoidal mesocolon. And in right side, right ureter, there is another mesocolon present, which is called root of mesentery. This is root of mesentery because this root of mesentery contains the small intestine coils. It is starting the jejunal- duodenojejunal flexure and go to the cecum region basically. So it crosses the ureter in anteriorly. So these are some anterior relations, and all anterior abdominal wall, coils, jejunum, cecum, all are the relations. We can write another cecum, intestine coils, intestine coils, and all. Then, so this about the ureter. This about ureter, full things. Length, extension, ori- orientation, all things. Then this is about the ureter. So next time we are starting the head and neck portion. Thank you.